The treatment paradigm of non-metastatic castration-resistant prostate cancer has gone through a revolution in the last 1 year. We saw approval of apalutamide, we saw approval of enzalutamide, and we are going to see darolutamide approval happening very soon. So we have these 3 drugs with level 1 evidence based on clinical trials, which more than 1,000 patients in each of these trials. So very rigorously conducted clinical trials. So not surprisingly, these drugs have already been a part of NCCN guidelines, especially these drugs now already a part of NCCN and AUA guidelines, especially enzalutamide and apalutamide, which are already approved and are mentioned in the guidelines as level 1 evidence. So if you look at these guidelines, there are level of evidence, like how strongly the panel members of these guidelines felt for these drugs, like they should be used for our patients. And without any surprise here, we see these drugs are endorsed by NCCN and AUA guidelines for treatment of non-metastatic castration-resistant prostate cancer with level 1 evidence. What do guidelines say about using abiraterone plus prednisone for non-metastatic castration-resistant prostate cancer? As we know, there has not been a rigorously conducted phase 3 trial, registration trial, supporting the use of abiraterone with prednisone in this setting. However, there are going to be some patients who may be candidates for this option for abiraterone, like patients who have seizures in the past. They are obviously not eligible for treatment with enzalutamide, for example. So if they are not eligible for these newer drugs like enzalutamide and apalutamide, of course we need some options for them. So abiraterone doesn't have the level 1 evidence, category 1 recommendation for non-metastatic castration-resistant prostate cancer. But if I have a patient who is not eligible for treatment with apalutamide or enzalutamide, I would be very glad to use abiraterone and prednisone. So do I prefer any of these agents over other, like apalutamide, enzalutamide, or darolutamide for treatment of non-metastatic castration-resistant prostate cancer? Answer is no right now. And reason being, these drugs have not been compared with each other. So I agree that these drugs were tested in large phase 3 trials compared with placebo. But we all know there are caveats of across the trial comparisons. And because they have not been compared with each other, at least as of today, I cannot say one of these drugs are better over other. I think we need studies comparing these drugs, comparing quality of life, comparing treatment outcomes to be able to say which drug is better, which should I use. As of now, I think all these 3 drugs, apalutamide, enzalutamide, and darolutamide, are considered equal. And I don't have any specific preference for one of these right now.